Here we go. If you have any questions, feel free to stop me at any time, guys. I'm going to post this video as soon as we're done. But what we're going to do is go through our 12 cranial nerves. Cranial nerves are neat because they're the only nerves in your body that don't go to the spinal cord. You have obviously most of your nervous system in your body is going to be coming out of your spinal cord. They come from your spinal nerves at all the different levels, but you have 12 nerves on either side, your right and left side of your body, that come straight out of your brain. And so these are your 12 cranial nerves, and we're going to go through them pretty quick here and look at the slides you guys made, look at your quick videos, and I'll add some things that we might need to change or switch up. Our test on Wednesday, we're going to have a matching section that deals with these cranial nerves. So make sure you pay close attention to what I say about the cranial nerves because I wrote the questions. So keep that in mind. All right. So let's just roll through. Cranial nerve number 1, if I can click correctly. Cranial nerve number 1, that's the instruction. Cranial nerve number 1 is the olfactory nerve. Olfactory, if you ever know anything about that word, olfactory means to smell, means the sense of smell. It is 100% sensory. It's going to, like as Rachel and Rakibia said here, it conveys sensory information associated with smell. It is the shortest of the cranial nerves, and here's very little unique anatomy that they put in here. It goes through the cribriform plate, and so it's the only one of your nerves that ends in this thing called a bulb, and it rests in the base of your skull here over these two little, so here's our skull, there's our skull, and these two little areas here, this is the cribriform plate, and your olfactory bulb would be right in those little notches. And if you look real close, there's little tiny holes in the bottoms of these little areas here, the cribriform plate, and that's going to go down through your skull into your nasal cavity, and it's going to produce all of these little receptors for your olfactory nerves that go down and provide your sense of smell. Very good little video here. Great job, guys, on this slide. But I got a cute little video here that shows us. This is the
olfactory nerve. He is going to guess what he smells. Go. What is it?
I don't smell nothing. I don't smell nothing.
Why is he so scary? Hurry up. Are you ready for real?
I don't smell nothing.
Call it.
I don't smell. Wait a minute.
Hold up. What?
Ketchup.
No, mustard. Take it out.
All right.
Mustard. Oh my goodness. This is the olfactory
let me stop the
nerve.
video here.
He is going to guess
Right,
what he smells.
All right. Got to figure out how to stop this. Sorry, guys. All right, so that was a silly little video. Thank you. I think that was Rachel's voice there. I heard, but very, very good stuff there with that little video, and actually pretty close to what they would do in a doctor's office in real life. Probably wouldn't use mustard because of the example that you saw there. Mustard has a distinct taste, but not quite a distinct smell. And that's why he thought maybe it was ketchup, because he had maybe that kind of condiment, probably more from the feel than the smell. But usually if you did need to test olfactory nerve in a clinical setting, you would use something that's very familiar and something that has a very strong smell. The classic one that they use is coffee grounds. Coffee grounds, have a little coffee grounds underneath the patient's nose, say, what do you smell? Pretty much everybody that's a grown-up adult will be able to tell you, I smell coffee, and you get a good test of the olfactory nerve. Great job, girls.
This is the olfactory nerve.
I don't want to do that. Stop. All right. Cranial nerve 2 is the optic nerve. I think that Sidaria and Ernesto may have worked together a little bit on this one. Nice picture of the eyeball there. But optic nerve is sensory as well. And if you use common sense, optic nerve, sensory, it is the nerve for vision. Function of nerve is what do normal activities, blah, blah, blah. Nerve is what helps us see and react with our eyes. It's the only tract in the central nervous system that can leave the cranial cavity, which makes it the only one that can be visualized clinically. Yeah, okay. So you can see it through the, like when they're looking at your eye through there, you can definitely see that. The big thing though, a big takeaway I want to give you from this is the olfactory nerve. I'm going to show you a picture here. The olfactory nerve crosses at the optic chiasm. One other unique thing about, go ahead.
So are all these nerves a part of the CNS?
Yes, this is all central nervous system because, yep, absolutely. All right, so all of our nerves that we're going to talk about today are only on the right side or the left side of the body, except for this one. And so this is what we have here. So for the optic nerve, you actually are going to get information from both your left eye and your right eye to both sides of your brain. And the idea behind this is that if you lose an eye, you still get information about the whole world to all of your brain. And so what happens here is that nerve fibers from both the left and the right eye are going to come down here to what's called the optic chiasm. Optic chiasm is a place just behind your pituitary gland, about right there in the brain. And you're going to cross, some nerve fibers cross to the opposite side, while some nerve fibers stay on the same side. And so you can tell what's happening with a person's visual field based upon where they might have a lesion in their optic nerve. If you have a lesion anywhere in front of the optic chiasm, you still get all the information about the visual world. You lose some of your 3D perception because you only have one eye, but you still are seeing the whole world. On the other hand, if you have a lesion back here behind the optic chiasm, you actually will lose the ability to perceive half of the world. So if your problem is on the right side of your brain, you actually lose the ability to perceive the left side of the world. Left side of your brain, you lose the ability to perceive the right side of the world. And it's pretty wild because what you do is you're losing information from half of the nerve fibers because they're crossing. That's the big thing about the optic nerve, is that both nerves are going to transmit information to both sides of your brain. And that's the only cranial nerve that does that. And it crosses, like I said, in that point called the optic chiasm. Another thing that we're looking for here was the eye test. And I talked to Sidaria about it. I tried to get her to do it, but optic nerve is really easy to test. It's something that we test every year for our physical exam. It's something that you've been testing every year since probably about the first or second grade when you had an eye test. They put an eye chart on the wall, said cover up one thing, read that line. And if you were too young to read, they might even say, what objects do you see on this line? Cover up your other eye. What objects do you see? What letters do you see on this line? Things like that. So normal eye test is going to test cranial nerve 2. All right, cranial nerve 3 is the oculomotor nerve. I love the name of the oculomotor nerve because, like a lot of the things that we do in anatomy class, it tells you what it does. Oculomotor, motor, movement for the oculo, eye, movement for the eye. It's mainly motor, pretty much all motor, a little bit of sensory in it, but all motor for the eye. It's going to control all of the muscles that move your eye except for 2, and we'll talk about those in just a second. It also innervates the pupil and the lens, the upper eyelids, and all of your muscles responsible for gaze. All right?
Innervate just means move, right?
One more time.
I said innervate just means move, right?
Innervate just means provides nerve fibers for. So in this situation, yes, it provides the nerve fibers for the movement of it. But it could also, innervate could also mean provide sensory nerve fibers. But in this situation, this is nerve fibers for moving. Got a little test here from Lauren. Let's see how she does. I guess this is the Ava hand, baby, making an appearance.
Yep.
All right, so this is how you would test actually 3 of our cranial nerves. Cranial nerve 3, pretty straightforward, and we'll get to the other 2 in just a second. And so what you're going to do is you're going to tell your patient, that's one of the things we're missing from the video. Good job though. You're going to tell your patient, don't move your head and follow my finger with your eye. Now, it's very important that you say don't move your head and that you watch to see whether or not your patient moves their head, because if they have a lesion in their oculomotor nerve, then one of the things that they're going to do is as you move your finger, they're going to follow it with their head. And when you say, nope, you moved your head, they're going to say, no, I didn't, because they've been subconsciously moving their head to follow movement. And so that's something you need to be very clear on, because people get used to being able to move and see the world. And so a lot of times they don't even perceive the fact that they're moving their head when they're following that finger. And if you notice what Ava did there for Lauren was she made an H. That tests all of the areas of the oculomotor nerve. And one other thing that you can do to finish the H, if you want to, not all doctors do it, but a lot of times if you want to do a real good test, you can do your H, go back to the middle, and then go to touch the patient's nose to check for convergence of the eyes, make their eyes cross. Very good job, Lauren. All right, rolling on to cranial nerve. Oh, let's start the video again. Rolling on to cranial nerve 4. Cranial nerve 4 is the trochlear nerve, and it's the first nerve that also helps move the eye. It's just a motor nerve. It's a short nerve that runs from the brain to the eye, outward and down movement of the eyes. The trochlear nerve is going to innervate the superior oblique muscle. The superior oblique muscle is a weirdly shaped muscle. Let's see if I can find my eye here. So I got my eyeball here. So there's your eye. And if we go to the side, we have this muscle on top, and I'm going to get it out of the way so we can see a little bit better. Superior oblique muscle is going to run beside the eye, but then go to this little area where it kind of acts like a pulley to go back to the top of the eye. So it actually is able to pull the eye to allow you to look down and out. Down and out provides that movement. And that's what's pretty cool. Superior oblique muscle nerve, the trochlear nerve, cranial nerve 4, is the only nerve that innervates that single muscle. One muscle for movement of the eye. It's the only cranial nerve that exists from dorsal to brainstem. Interesting. I didn't know that. Okay. But the main thing about the superior oblique muscle is that down and out movement. If you have somebody, obviously you're going to use the test that Lauren just showed us. If you have somebody with a lesion of the superior oblique muscle or a lesion of the trochlear nerve, they'll have the classic symptom is trouble walking downstairs, because as they go around a flight of stairs and go to the next, that down and out movement to see those next flight of stairs, they have trouble with it. And so you can end up with a trochlear lesion. Carrying on. Cranial nerve 5, the trigeminal nerve. Trigeminal nerve is, you can look at the name here, does 3 different things. Trigeminal nerve. It actually has 3 different thick branches coming out of the base of your skull. It does sensory and motor innervation to the face. Main function is transmitting sensory information to the skin, sinuses, mucous membranes in the face. It also stimulates movement in the jaw muscles. I would posit to say that I don't disagree. There's nothing wrong here, but I would probably say the main function, the most important function, is this movement of the jaw muscles. The classic way that people say it is it provides muscles of mastication. Mastication is the act of chewing, and the trigeminal nerve provides you with those muscles of mastication. You got a nice little test here, which is the sensory part of the trigeminal nerve, which is just someone touching their eye and showing a blink in response to touching the eye. I'll be honest with you, that is not a test that most doctors are going to perform in a clinical setting, just because people don't like to have their eye touched with Q-tips. The most common way that you test trigeminal nerve in a laboratory setting is you'll usually stand behind your patient or in front of your patient, put your hands on their jaws and ask them to clench down. That's testing the muscle of mastication. You can feel the evenness of the clench of the muscles. And, you know, if there's any unevenness, then you can say, hey, you know, can you do it even on both sides? And if they can't, it's a possible lesion of the trigeminal nerve. So trigeminal nerve, muscles of mastication, and some sensory for mucous membranes and things around your face. And let's watch that eyeball again. Woo, woo. All right, abducens nerve, I said I would take because nobody signed up for it. That's no big deal. Abducens nerve, I also said couldn't be two people because it's so simple. And that's one of the reasons I signed up for it as well. The abducens nerve is a lot like the trochlear nerve. It's the other nerve that deals with movement of the eye. The difference is the abducens nerve, there's your eyeball again, is going to be on your lateral rectus muscle. Lateral rectus muscle beside the eye. It's going to be from left to right movement of this eye, and on the other side will be from right to left movement. So it's out movement. It most commonly deals with tracking movement. So when something runs in front of someone, being able to follow it from left to right. The most common way that people have a lesion of lateral rectus muscle the abducens nerve is they have trouble reading. People have trouble reading because they can't track the things from left to right. They have to move their whole head to be able to go back and forth. So cranial nerve 6, just movement, single muscle. Abducens nerve goes to the lateral rectus muscle, and the most common way, the most common thing is having trouble reading. So halfway there, we got 3 nerves that all have to do with that H test, 3, 4, and 6. Okay, so let's carry on. Cranial nerve 7. Cranial nerve 7 is the facial nerve. It is both sensory and motor. It's another one that's similar to the trigeminal nerve where it actually does a lot of different things. It's a big, thick nerve that comes out of the base of the skull, goes all over the place, carries nerve fibers to control facial expressions and movements, and taste to the anterior 2/3 of the tongue. Very, very good there. That's important. Okay, so as facial expressions and movements, taste to the anterior 2/3 of the tongue, and tear production. Very, very good on those. So it helps with the lacrimal duct for the tear production. And so if you want to test the facial nerve, let's see what Emma does for us.
So there's 2 tests that you do for the facial nerve. The first one is for your upper face, and that is when you look up and raise your eyebrows to look for even wrinkling in your forehead, but that won't be happening because I have a fat forehead.
Oh.
And for your lower face, you smile or puff out your cheeks and feel for even muscle tone.
Very good, Emma. Absolutely. That's a great one. Lift your eyebrows for me and give me a big smile. Those are absolutely 2. Come on, baby. Those are absolutely 2 beautiful tests for the facial nerve. Another similar thing that people do is similar to the one that they did for the thing is just take something very lightly and touch the sides of the face and test for numbness. But the classic one is give me a big smile, then give me a big frown. Big smile, big frown. Make sure it's even on both sides. If you have a facial nerve lesion, this is one of the easiest ones to see because it also is one of the most common pathologies of the cranial nerves. Because of where the facial nerve exits right here in front of the ear, ear infections, a lot of bacterial infections can actually compress the facial nerve and cause facial nerve paralysis. Classic demonstration of facial nerve paralysis is called Bell's palsy. Bell's palsy is usually from an infection, usually it's temporary, and you end up with a drooped face. You end up with very dry eyes because a dry eye on one side because you can't produce tears from the lacrimal duct, and you can't move the facial movement, and you also have numbness in the side of your face. If it lasts long enough, it can actually cause permanent problems where you have people that you end up seeing that have a uneven smile, things like that. But usually it bounces right back, and you end up with a facial nerve recovery. Taste to the anterior 2/3 of the tongue. That's important because we're going to talk a lot about senses today, and taste is one that goes across 2 different cranial nerves, and we'll get to the other one in a bit. Very good job, Emma.
So
Keep trying to play the video again. All right, number 8 is the vestibulocochlear nerve, sometimes called the auriculocochlear nerve. Vestibulocochlear nerve tells us a little bit more though, because it breaks it into 2 different parts, and it does 2 different things. 2 parts, the vestibular and the cochlear. If you know anything about anatomical words, vestibule, vestibular sense, is all about balance, the vestibular nerve. Whereas the cochlea is this snail-looking dude inside of your ear, which is all about hearing. So the vestibulocochlear nerve is going to deal with hearing and balance. And really, since it deals with 2 different things, there's 2 different tests that you do. Naya had a great one that you could do to check for balance, but I told her to try to check for the hearing. So let's see what she does here with this video. 17 seconds. Perfect. Oh man, look at her. I know her.
93.
All right, let's try this. Go back here.
93. 45. 72. 81.
Very good, very good. That is a really good demonstration of a quick hearing test that you could do. Very good job, Naya. A lot of times, and if you notice what she was doing there, she was whispering and making sure that her mom there as a guest star could repeat the numbers that she heard. Another trick, sometimes people do that. A lot of times people maybe misunderstand what you say and try to say something different. Another thing that people do, especially if you're in a very, very quiet doctor's office, is instead of whispering, you can tell your patient to close their eyes and instead use your fingers to make little sounds. And you can start very, very far out and then come closer and then go right and left, and they can tell you which side they hear it on, and you can check like that. For balance, that's one that you have to be careful with in a clinical setting, because if you try to test it too intensely, you can cause your patient to fall over. So classic test for balance is you tell your patient to stand up, usually stand behind them so they can not be too afraid of what you're about to do. Put your arms kind of underneath their arms so that if they fall, you can be there to catch them. So tell them to put their feet side by side, close together, straight up and down, arms out to the side, and then to close their eyes. Because we use so much of our balance with our vision, and if you can see the horizon, you can stay balanced. As soon as you close your eyes, you start to maybe drift one way or the other. You got possibly a vestibular problem. Very good job, Naya. But sensory only, yep, with balance and hearing. All right, glossopharyngeal nerve, ooh, poor John. All right, but we can figure out what a glossopharyngeal nerve does just by looking at the word. Glosso and pharyngeal. Pharyngeal, pharynx, your throat. Glosso, do either Lauren or Emma know?
Say that again.
What the prefix glosso means when it comes to anatomy. All right, so pharyngeal is pharynx in your throat. Glosso is the prefix for tongue. Anytime you see glosso, you're talking about your tongue. So tongue and throat. So the glossopharyngeal nerve is the nerve that is going to do sensory and motor. It is going to provide the other part of your taste. So facial nerve did the anterior 2/3 of your tongue. The glossopharyngeal nerve does the posterior 1/3 of your tongue. So it's the taste in the kind of the back of your throat, the other part of your tongue, and the muscular part of the glossopharyngeal nerve is going to be the swallowing reflex. You start to swallow, the glossopharyngeal nerve kind of takes over and does that work for you. It also provides the gag reflex. I can't remember who I told, but I think it was John. I can't remember about this test. I said, we're not going to perform this test because this is something that you could, elicit vomiting for. So gag reflex, if you needed to test the glossopharyngeal nerve, you would take a swab, ask your patient to open their mouth, and go to the palatine tonsils on either side of the back of the mouth and elicit a gag. Not exactly something you want to be doing in a mixed company, but yeah, glossopharyngeal nerve, gag reflex, we're carrying on. The vagus nerve. This is one of the coolest nerves here because of the picture that Grayson showed for us. Check this nerve out. This nerve is doing all kinds of things. It's one of the most important things is one of only a couple of nerves that are going to straight up leave your head. So most of the nerves we've dealt with so far have been all about this area of our body, cranial nerves, cranial functions. The vagus nerve is going to be both sensory and motor, and it's responsible for regulation of internal organs, digestion, heart rate, respiratory rate, insulin production, all of these things. Now, when you look at it, digestion, heart, respiratory, insulin, these are the things that straight up keep you alive. And so the reason you would want a cranial nerve to do this stuff is because if you have a lesion in your spinal cord, you don't want to die. And so a spinal lesion doesn't stop your heart beating because your vagus nerve has that pacemaker activity that's going to keep that heart beating. Your vagus nerve has a branch called the phrenic nerve that's going to dive into the diaphragm that we actually are going to find later that when we do our dissections, that keeps that respiratory rate going because you want to breathe even if you have a spinal cord injury. All of these things keeping you alive. That's what the vagus nerve does for us. Really cool nerve, the longest of the cranial nerve. It's the widest distribution. It goes all over the body, does lots of different things. No real test for the vagus nerve, and I told Grayson that when she asked about it. There's a couple things. Gag reflex does help a little bit with the test, but more the vagus nerve. If you have a vagus nerve lesion, you got some big problems, and it's not exactly something that would hide. You would have pacemaker problems, you would have respiratory problems. Vagus nerve just kind of does all kinds of different things. And there you go. Rolling on. Cranial nerve 11, the accessory nerve. Oh my goodness gracious. Somebody left out my accessory nerve. I won't call them out. Oh well. All right. So cranial nerve 11 is the accessory nerve. It is going to be, it's called the accessory nerve because it is the accessory for breathing. When we breathe, normally we have one muscle that does our breathing. Muscle right here, big giant dude, the diaphragm. And the accessory muscles are going to be all the muscles like between your ribs and your throat, in your shoulder, that are going to be accessory muscles for breathing. When you want to take a really deep breath, not only do you use your diaphragm, but you use your accessory muscles. You really get that chest as large as you possibly can, lower that pressure as much as you can so that you can breathe in as much air as possible. The accessory nerve is going to go down out of your cranial, this is the other guy that goes out of your head and goes into your muscles along your shoulder, your trapezius, things like that, and provides the accessory muscles for breathing. Testing the accessory nerve is pretty straightforward. You tell your patient you put both hands on either shoulder of your patient and then ask them to shrug. If they had a problem with an accessory muscle and you asked them to shrug, they would shrug like this. And so obviously you have a lesion on the opposite side where you weren't able to shrug. Accessory nerve. Last nerve is the hypoglossal nerve. There's a little part of a word that we've already talked about, glossal, tongue. Hypoglossal nerve is going to be mainly motor. A little bit of sensory, but mainly motor. Function is to provide the tongue. I'm guessing we covered up our part in our picture here. Let's see if I can slide this out of the way. Nope. Provide the tongue. It provides motor for the tongue. Runs under the tongue, provides the muscles for the tongue. It's all about moving the tongue is the hypoglossal nerve. All right, Jan Derry's video. Let's check it out. If you want to check the hypoglossal nerve, what would you do? Oh no, it's restricted. Bless their hearts. Let's see. How can I figure out how to do this? Probably this is going to not work very well. I'm gonna have to do it on my phone. Yep, it's private. Oh, never mind. I can't do it on my phone if it's private. So yeah, Jen Derry, make your video on private so that we can see it. I'll do it for you real quick though. But Jandari, don't forget to show me that video so I can give you some credit for it. But pretty straightforward. If you want to test the hypoglossal nerve, ask your patient to stick out their tongue. If they had a lesion in the hypoglossal nerve and you asked your patient to stick out the tongue, this is what they would do. Because you have two and you only are able to use the side that works. And if you ask your patient to stick out their tongue is going to point to the side that they have the lesion on because they weren't able to push it out from that side. So if your patient does this, then they have a lesion on the right side of their face. All right, guys, those are our 12 cranial nerves. Great job. Jandari, like I said, just make that unprivate so that we can see it. And go back to this if you need to look back over it. I'm gonna post this video here in just a second after I edit it up a little bit. Tomorrow, we're gonna do our pathology. I'm gonna do a short little talk about pathology. We'll add some pathology notes. We have a guest speaker. The video is already up. I suggest you watch it. You can definitely learn something about nervous system pathology. We'll review anything that we need to review for our test. Then we'll take our test on Thursday. Any questions? All right, y'all enjoy the rest of your Tuesday and don't party too hard tomorrow.